Hello again. I'm Dr. Mark Poray, a family and sports chiropractor in Brooklyn, Ontario. In this blog, I'll be talking about some of the symptoms and treatments for herniated cervical discs. Now, there are a number of things that can cause herniated discs in the neck. First of all, as we age, the discs in our necks lose some of their flexibility and elasticity. The ligaments become brittle and more easily torn. However, a disc can herniate after repetitive stresses or an injury to the spine. When the disc is placed under load vertically and then torqued, fibers on the outside of the disc tear, allowing the soft gel-like center to push outwards, causing a bulge like a bubblegum bubble. This places pressure on the nearby spinal nerves, which result in radiculopathy or shooting pains down the arms, or in the spinal cord, which may cause myelopathy, which are painful symptoms in the muscles at the ends of those nerves. So the bulging or herniated disc in the neck can cause neck pain, radiating arm pain, shoulder pain, and numbness or tingling in the arm or hand. Weakness in the arms is a definite sign that you should be seeking some sort of professional treatment, some sort of medical professional treatment. Now, in order to diagnose the problem, you'll be given a complete examination of the neck, arms, and lower extremities. The lower extremities are to make sure that the problem isn't occurring somewhere further down or there's some sort of more serious pathology. Your flexibility, range of motion, touch, and strength will help to determine which nerve is actually affected. And although x-rays will not show the actual disc herniations, one may be ordered to see how the spine is reacting to the injury, and then an MRI may be suggested to narrow down the extent and the exact location of the bulge. The most common nerve affected is the C4 or C5, which may cause pain over the shoulder, strength changes in the biceps or the triceps, and another commonly affected joint is the C6 or C7 at the bottom. So C4 is in the middle, C6, 7 are down at the bottom. C6 may cause neurological symptoms around the thumb or forefinger, while C7 or T8 will cause symptoms which may move towards the baby finger. There will also be characteristic reflex changes in the biceps or the triceps. Once your family doctor or chiropractor has determined that you have a disc bulge, there are several possible approaches. Your family doctor may prescribe NSAIDs or non-steroidal anti-inflammatories or COX-2 inhibitors. For patients with severe pain, they may decide on oral steroids like prednisone or a Medrol dose pack. Now, you should be aware that these can only be used for a short period of time, like a week. Other conservative approaches include traction, which reduces some of the pressure on the nerve root, but will not really work on the disc herniation. Gentle chiropractic manipulation can help to reduce joint dysfunction and pain. This is an ideal application for the neuromechanical impulse instrument adjustments, which do not utilize any rotation of the spine at all. Osteopathic soft tissue manipulation can also be quite helpful. Cervical collars may be recommended to provide some traction and rest to the area. Now, in severe cases, anti-inflammatory injections may be recommended by your family doctor. Acupuncture has also been shown to provide some relief during the healing period. The last resort is surgical intervention, which can provide reliable pain relief when done by an experienced spine surgeon. So when you're looking at this as an option, make sure that you look into the background of the surgeon that you're talking to. The chiropractic approach to this condition first lies in not aggravating the problem. Since the herniated disc is the result of combined rotational and axial trauma, it is essential not to apply similar forces while the disc is healing. The traditional chiropractic cervical manipulation involves a quick, short impulse to a joint which is locked in one direction or more. This may be rotation, lateral flexion, or forward bending, or a combination. However, with a disc bulge, there is rotational damage to the disc fibers, so it's important not to add to this stress. The adjustment will either eliminate rotation altogether or utilize mechanical impulses like the or mechanical instruments like the impulse adjuster. These instruments may also be combined with therapeutic ice and heat applications, gentle stretching, and strengthening exercises and massage. Now, it's important to remember the disc tissues are extremely slow in healing, and you must demonstrate some degree of patience as this healing takes place. It's not unusual for this improvement to require 6 to 12 weeks. I hope this has been helpful. Good luck if this is the problem that you have. You can find more video blogs on other conditions on my website at www.drporay.com. For a consultation on these or any other conditions, give my office a call. I'm located in Brooklyn, just north of Whitby. Thanks for your attention. See you the next time.